multiple response, select N, and select all that apply SATA questions. These are hands down some of the trickiest ones on the NCLEX. Miss just one option? Boom. No points. And let's be real, you do not want to fail the NCLEX. But don't stress. In this video, we're breaking it all down step by step. We'll go through a full exam-style practice test, so you know exactly how to tackle these questions the right way. Not only will we go over the correct answers, but we'll also explain why each option is right or wrong. Plus, we'll clear up the confusion between Select N and SATA, so you know exactly what to do when you see them. Let's dive in. Let's talk about multiple response Select N questions on the next generation NCLEX exam. These are a bit more specific because you'll be asked to select an exact number of correct answers from a list. For instance, a question could say, select 3 of the following options. Now, the key is that you must choose exactly 3, not 2, not 4. It's very clear. The question tells you how many correct answers to pick. So when you get this kind of question, you'll need to carefully read through the options and make sure you select the correct number. Select all that apply questions. On the flip side, we have select all that apply SATA questions. These are similar, but a little different. In SATA questions, you're asked to select all the correct answers, but here's the catch. The question doesn't tell you how many answers to pick. You're just supposed to choose all the options that are correct. And remember, no partial credit. If you miss even one correct answer or pick a wrong one, the whole question is considered incorrect. So you have to be thorough and make sure every right option is selected. Key differences between multiple response Select N and SATA questions. Let's break down the differences clearly. Here's what the table shows. Number of correct answers. This type of question will tell you exactly how many correct answers to select. For example, you might be asked to select 3 answers out of the choices. In SATA questions, no number is specified. You need to select all correct answers no matter how many. Partial credit. There's no partial credit here. You have to select the exact number specified in the question. So if you pick 2 or 4, it won't count. Again, no partial credit. If you miss even one correct option or select an incorrect one, the question is marked wrong. It's like a SATA question, but with a twist. You know the exact number of answers you need to pick. You're asked to pick all the answers that are correct, but there's no set number, so the number of correct answers can vary. Scoring. Your answer is considered correct only if you select the exact number of correct options as stated in the question. You need to select every single correct answer to be marked as correct. Missing any of them results in the question being wrong. Strategy. You need to focus on picking exactly the number of answers the question tells you. Be careful and make sure you meet that exact number. For SATA, carefully evaluate each option and make sure you select every one that is correct. Don't leave anything out. So here's the bottom line. Multiple response Select N questions are all about selecting the right number of correct answers. With SATA questions, it's all about making sure you pick every single correct answer. For both types, attention to detail is key. All right, let's talk about a smart way to tackle multiple response select questions, the process of elimination. This strategy is a lifesaver when you're faced with tricky options. The goal? Get rid of the obviously wrong answers first, so you're left with a smaller, more manageable pool of choices. Now let's put this into action with a real scenario. The situation. You're a nurse reviewing a patient's prescription, and you see they're on ciprofloxacin, a fluoroquinolone antibiotic. You need to know when ciprofloxacin is actually used, and just as importantly, when it isn't. The question. Select the 2 most common indications for ciprofloxacin. Options. Urinary tract infections, UTIs, meningitis, respiratory tract infections, osteomyelitis, skin and soft tissue infections. Maybe? Let's see. Step 1. Eliminate the clearly incorrect choices. Meningitis? Nope. Ciprofloxacin isn't the first-line antibiotic here. For bacterial meningitis, we typically reach for ceftriaxone or vancomycin instead. Cross it out. Osteomyelitis. While ciprofloxacin can be used for certain bone infections, it's not the go-to antibiotic. Usually, vancomycin or clindamycin is preferred. So this one's out too. Step 2. Focus on the remaining options. UTIs? Absolutely. Ciprofloxacin is commonly used for urinary tract infections, especially those caused by E. coli or other susceptible bacteria. This one stays. Respiratory tract infections? Yes, ciprofloxacin is effective against certain bacterial pneumonias, especially in cases where other antibiotics aren't working. This one's a keeper too. Skin and soft tissue infections? Maybe, but not as common as UTIs or respiratory infections. While ciprofloxacin can treat some skin infections, especially those caused by Pseudomonas aeruginosa, it's not one of the most common indications. The two best choices? Urinary tract infections, UTIs, respiratory tract infections. By eliminating the wrong answers first, we made it so much easier to focus on the correct ones. This strategy works wonders. Use it every time.
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this.
Take note of negative phrasing. Now listen carefully. Some questions use negative wording like, which of the following is not true, or which intervention should be avoided. These words can completely shift how you approach the question. Instead of selecting the correct answer, you must now focus on the opposite of what you might normally consider right. So, be extra cautious when you see negative phrasing. A nurse is caring for an elderly patient with chronic kidney disease and hypertension. Select the 2 interventions that should not be implemented in the management of this patient's blood pressure. Options: administering angiotensin-converting enzyme inhibitors using diuretics to manage fluid retention, giving beta blockers to reduce blood pressure, restricting sodium intake to less than 1,500 milligrams per day, discontinuing antihypertensive medications if the patient experiences dizziness, encouraging the patient to limit fluid intake drastically without considering renal function. Step-by-step analysis using the negative phrasing strategy. Eliminate correct interventions. What should be done? Administering ACE inhibitors. These help protect kidney function and reduce protein loss. So this is a correct intervention. Eliminate it. Using diuretics to manage fluid retention. Diuretics help reduce swelling and control blood pressure. Again, this is an appropriate intervention. Eliminate it. Giving beta blockers. These are commonly used to prevent heart complications in CKD patients. Eliminate this one too. Step 2. Focus on harmful interventions. What should be avoided? Restricting sodium intake to less than 1,500 milligrams per day. Sounds good, right? But here's the problem. Excessive sodium restriction can cause electrolyte imbalances and worsen kidney function, especially in advanced CKD. This should be avoided. This is a correct answer. Discontinuing antihypertensive medications if the patient experiences dizziness. Wait, dizziness can be a side effect of these meds, but stopping them suddenly is dangerous. It can cause blood pressure spikes and rebound hypertension. The solution? Adjust the dose. Don't stop the medication. This should be avoided. This is a correct answer. Encouraging the patient to limit fluid intake drastically without considering renal function. Sounds like a safe move, right? Wrong. Drastic fluid restriction can cause dehydration and kidney stress. Fluid intake should be adjusted based on renal function, not just blindly restricted. This should be avoided. This is a correct answer. The two interventions that should not be implemented are restricting sodium intake to less than 1,500 milligrams per day, encouraging the patient to limit fluid intake drastically without considering renal function. Key takeaways. Negative phrasing changes everything. Always look for what should not be done. In chronic kidney disease and hypertension, interventions must be carefully balanced. Sodium restriction and fluid intake need precise adjustments. Going too far in either direction can cause harm. Eliminate correct interventions first, then focus on harmful or inappropriate ones. Read the question carefully. One small word like not can be the difference between getting it right or wrong. Select all of the following considerations for the use of ciprofloxacin. Options. 1. Ciprofloxacin is effective against Pseudomonas aeruginosa. 2. Ciprofloxacin is contraindicated in patients with a history of myasthenia gravis. 3. Ciprofloxacin should not be used in patients under 18 years old due to risk of tendon rupture. 4. Ciprofloxacin can cause QT prolongation and should be used cautiously in patients with heart conditions. 5. Ciprofloxacin is a first-line treatment for viral infections. Explanation and process of elimination. Step 1. Eliminate the incorrect answer. Let's start by removing what we know is incorrect. Option 5. Ciprofloxacin is a first-line treatment for viral infections. Wrong. Ciprofloxacin is an antibacterial agent, not an antiviral. It has no effect on viral infections like the flu or common cold. Eliminate this option. Step 2. Evaluate the remaining options. Now, let's go through each of the remaining statements one by one. Option 1. Ciprofloxacin is effective against Pseudomonas aeruginosa. Correct. Ciprofloxacin is often used to treat infections caused by Pseudomonas aeruginosa, a common gram-negative pathogen. Keep this option. Option 2. Ciprofloxacin is contraindicated in patients with a history of myasthenia gravis. Correct. Fluoroquinolones, including ciprofloxacin, have been linked to worsening symptoms in patients with myasthenia gravis. Keep this option. Option 3. Ciprofloxacin should not be used in patients under 18 years old due to risk of tendon rupture. Correct. Fluoroquinolones carry a risk of tendinitis and tendon rupture, especially in children and adolescents. Keep this option. Option 4. Ciprofloxacin can cause QT prolongation and should be used cautiously in patients with heart conditions. Correct. Ciprofloxacin has been associated with QT interval prolongation, which can increase the risk of serious heart arrhythmias. Keep this option. Step 3. Final selection. After careful evaluation, the correct answers are: ciprofloxacin is effective against Pseudomonas aeruginosa. Ciprofloxacin is contraindicated in patients with a history of myasthenia gravis. Ciprofloxacin should not be used in patients under 18 years old due to risk of tendon rupture. Ciprofloxacin can cause QT prolongation and should be used cautiously in patients with heart conditions. Key takeaways. In Select All That Apply SATA questions, there is no fixed number of correct answers. You must analyze each option independently. Use the process of elimination. First, remove options that are clearly incorrect, like option 5. Then, carefully assess the remaining statements to identify the correct ones. Think critically. SATA questions test your ability to differentiate between facts, myths, and misleading statements. Take your time, and don't rush to select an answer just because it sounds right. By following this method, you'll increase your accuracy and confidence when tackling SATA questions. All right, so let's break this down. This is really important. Before anything else, you need to understand what kind of question you're dealing with. Are they asking for a specific number of answers, or is it open-ended? That makes all the difference. Now imagine this. You have a patient undergoing chemotherapy. Their regimen includes vincristine, and suddenly they start showing neurological symptoms. That's a red flag. So here's the question. Select the two most common neurological side effects associated with vincristine. Let's go through the options. Peripheral neuropathy, ototoxicity, muscle weakness, seizures, mucositis. Now pause for a second. What do we know about vincristine? The key here is recognizing its classic neurological side effects. The two most common? Peripheral neuropathy and muscle weakness. Why are these correct? Peripheral neuropathy. This one's huge. Vincristine is notorious for causing nerve damage, leading to tingling, numbness, and pain, especially in the hands and feet. Muscle weakness. Because vincristine affects nerve function, it also leads to muscle weakness. Patients might have trouble with movement or feel unusually fatigued. And why not the others? Ototoxicity. Nope, that's more of a problem with platinum-based chemo drugs like cisplatin. Seizures, not a typical side effect of vincristine. Mucositis. While mucositis, painful sores in the mouth and gut, happens with many chemo drugs, it's not a primary neurological side effect of vincristine. The key NCLEX takeaway. Here's what really matters. The phrase, select the two most common, tells you it's a multiple response select N question. That means you must pick exactly two answers, no more, no less, to get full credit. Knowing drug side effects isn't just about passing an exam. It's about protecting patients. Vincristine can seriously affect nerve function, so recognizing these symptoms early, that can make a huge difference in patient care. Got it? Good. Let's keep going.
Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the Next Gen NCLEX RN Practice Question Bank, Big Book of Question Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new next generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions.
Prioritize evidence-based choices. Take a moment and focus on what truly matters. When answering SATA or SELECT-N questions, always prioritize options that are backed by clinical evidence or best practices. Why? Because in healthcare, we rely on well-established guidelines to ensure patient safety and the best possible outcomes. So when you're unsure, choose interventions, diagnoses, or actions that align with current clinical standards and protocols. Let's apply this to a real NCLEX-style question. In this multiple response select-N question, you're asked to select 3 evidence-based nursing interventions to prevent atelectasis in a postoperative patient. Use the process of elimination to identify the most effective interventions. Select the 3 most effective evidence-based nursing interventions to prevent atelectasis in this postoperative patient. Options. 1. Encouraging the patient to use an incentive spirometer every hour while awake. 2. Administering pain medication as prescribed to facilitate deep breathing and coughing. 3. Maintaining the patient in a supine position to promote abdominal healing. 4. Providing frequent oral care to prevent aspiration. 5. Assisting the patient with early ambulation. 6. Applying abdominal binders. Explanation and process of elimination. Step 1. Eliminate clearly incorrect answers. Option 3. Maintaining the patient in a supine position to promote abdominal healing. Sounds reasonable, right? But think about it. Is lying flat the best way to help the lungs expand? Absolutely not. In fact, positioning the patient upright, or at least in a semi-Fowler's position, promotes lung expansion and prevents atelectasis. Eliminate this option. Option 6. Applying abdominal binders. While abdominal binders may provide comfort, they do not directly prevent atelectasis. Eliminate this option. Step 2. Evaluate the remaining options. Option 1. Encouraging incentive spirometer use every hour while awake. This is a gold standard intervention for preventing atelectasis. It encourages deep breathing, lung expansion, and mobilization of secretions. Absolutely correct. Option 2. Administering pain medication. Think about it. If a patient is in pain, will they take deep breaths? No. Pain inhibits deep breathing and coughing, leading to secretion retention and atelectasis. Proper pain control is crucial in preventing this. Correct. Option 4. Providing frequent oral care. Oral care is important, but does it directly help with atelectasis? Not really. While it can prevent aspiration, it doesn't help with lung expansion or secretion clearance. Eliminate this option. Option 5. Assisting with early ambulation. This is a key intervention after surgery. Walking helps the patient breathe deeply, mobilize secretions, and expand their lungs. Highly effective. Correct. Step 3. Final selection. The 3 most effective nursing interventions for preventing atelectasis in this postoperative patient are encouraging the patient to use an incentive spirometer every hour while awake, administering pain medication as prescribed to facilitate deep breathing and coughing, assisting the patient with early ambulation. Key takeaways. Incentive spirometry is critical for preventing atelectasis by encouraging deep breathing and lung expansion. Adequate pain management allows the patient to breathe deeply and cough effectively, both essential for preventing atelectasis. Early ambulation is one of the most effective ways to reduce post-op complications and keep the lungs clear. Remember, the NCLEX wants you to choose what's best for the patient, not just what sounds right. Always prioritize evidence-based, high-yield interventions. All right, let's make this simple. When answering select NN questions, your choices must directly match what the question is asking. If it's asking for interventions, pick only interventions. Don't get distracted by answers that sound good, but don't actually fit. The same rule applies to SATA, select all that apply questions. Stick to exactly what the question is looking for and avoid any vague or misleading options. Let's break it down with a real example so you can see exactly how to apply this strategy. Example, multiple response select N question. Scenario, a nurse is caring for a post-operative patient who is at risk for developing deep vein thrombosis. Select the 2 most effective evidence-based interventions to prevent DVT in this patient. Options, administering anticoagulant medication as prescribed, encouraging the patient to perform deep breathing exercises regularly, encouraging the patient to remain in a supine position during rest periods, assisting the patient with early ambulation, providing frequent oral care to prevent infection, elevating the patient's legs above heart level during rest periods. Step 1. Eliminate clearly incorrect or irrelevant options. Encouraging the patient to remain in a supine position. Nope. Staying in a supine position can actually increase the risk of DVT because it slows circulation in the legs. The goal is to keep blood moving, not let it pool and form clots. Eliminate this option. Providing frequent oral care. Good for hygiene, but completely irrelevant for DVT prevention. Oral care helps prevent infections, not blood clots. Eliminate this option. Elevating the patient's legs above heart level. Sounds like a good idea, right? But while leg elevation can improve venous return, it's not the best strategy for preventing DVT in a postoperative patient. Compared to walking and anticoagulants, leg elevation is less effective. Eliminate this option. Step 2. Evaluate the remaining options. Administering anticoagulant medication. Absolutely. Anticoagulants are one of the most powerful tools to prevent DVT. They stop clots from forming by preventing excessive blood clotting. This option is correct. Encouraging deep breathing exercises, important for lung health and preventing post-op complications like pneumonia, but does not directly prevent DVT. Eliminate this option. Assisting with early ambulation. Yes, getting the patient up and moving is one of the most effective ways to prevent DVT. Walking promotes circulation, reduces blood stasis, and significantly lowers the risk of clots. This option is correct. Final answer. The two most effective interventions for preventing DVT in a postoperative patient are administering anticoagulant medication as prescribed, assisting the patient with early ambulation. Key takeaways. Anticoagulants are essential for preventing DVT because they directly stop blood clot formation. Early ambulation is a must. It keeps blood flowing and prevents clots from forming. Deep breathing exercises and oral care. Great for other aspects of care, but not related to DVT prevention. Leg elevation. Helpful, but not the most effective strategy when compared to walking and anticoagulants. By focusing on specific, evidence-based interventions, you'll avoid getting tricked by distractors and confidently choose the best answers. All right, let's walk through this together, step by step. Imagine you're caring for a patient who's on warfarin therapy for atrial fibrillation. Your job? Ensure safe administration and prevent complications. Now here's the question. Question stem. A nurse is caring for a patient receiving warfarin therapy for atrial fibrillation. Select all the nursing considerations the nurse should implement to ensure safe administration of warfarin. Take a deep breath and focus on safety. Think about what truly matters when handling an anticoagulant like warfarin. Options. Monitor the patient's international normalized ratio INR regularly. Teach the patient to take warfarin with food to reduce the risk of bleeding. Advise the patient to avoid foods high in vitamin K, such as leafy greens. Monitor the patient for signs of infection. Educate the patient about the potential for black, tarry stools. Administer the medication at the same time each day to maintain consistent drug levels. Step-by-step analysis. Let's break it down, one option at a time. Monitor the patient's INR regularly. Absolutely. INR monitoring is crucial because it tells us if the patient is within the therapeutic range. If it's too high, they're at risk for bleeding. If it's too low, they're at risk for clots. This is a must. Teach the patient to take warfarin with food to reduce the risk of bleeding. Not necessary. Warfarin can be taken with or without food. The bigger issue here is dietary consistency. It's not about food reducing the risk of bleeding. This is a distractor. Advise the patient to avoid foods high in vitamin K, such as leafy greens. Yes, but let's clarify. It's not that the patient can never eat vitamin K-rich foods. The key here is consistency. Large fluctuations in vitamin K intake can mess with warfarin's effectiveness. Monitor the patient for signs of infection. This is not directly related to warfarin therapy. While infection monitoring is always important in general, it's not a priority here. Cross it out. Educate the patient about the potential for black, slight tarry stools. Yes. Why? Because black tarry stools can be a sign of gastrointestinal bleeding, which is a major complication of warfarin therapy. This is critical patient education. Administer the medication at the same time each day. Yes, consistency is key. Giving warfarin at the same time daily helps maintain stable drug levels, keeping INR in check and reducing complications. Final correct answers? Monitor INR regularly. Advise the patient to avoid large fluctuations in vitamin K intake. Educate the patient about black tarry stools as a warning sign. Administer warfarin at the same time each day. Key takeaways? Safety first. Always monitor INR levels to ensure the patient stays in the therapeutic range. Educate the patient. Warfarin has serious bleeding risks, and patients need to recognize warning signs like black tarry stools. Diet matters. The patient doesn't have to eliminate vitamin K, but they need to keep their intake consistent. Timing is everything. Giving warfarin at the same time daily helps maintain stable drug levels and reduces fluctuations in INR. By focusing on safety, effectiveness, and patient education, you can confidently tackle SATA questions like this without falling for distractors. A nurse is teaching a patient with diabetes about blood glucose monitoring. Now, let's go step by step. Select all statements that are true regarding self-monitoring of blood glucose. Options. 1. Blood glucose levels should be tested before meals and at bedtime. The patient should apply the blood sample to the test strip immediately after pricking the finger. 3. Blood glucose monitoring is only needed when the patient is feeling symptomatic. 4. The test strip should be kept in a cool, dry place away from direct sunlight. 5. The patient should wash their hands before testing to avoid contaminating the blood sample. 6. Blood glucose should be tested every hour to ensure the patient's levels remain stable. Now let's analyze this question carefully. What's being asked? This is a SATA question, which means select all that apply. We need to pick all the statements that are true regarding self-monitoring of blood glucose. But watch out. Some options are distractors. Distractors and misleading options. Option 2. The patient should apply the blood sample to the test strip immediately after pricking the finger. This is partially correct, but it's not the most relevant point. Yes, applying the sample promptly is important to avoid interference, but it's not the key takeaway for self-monitoring. Option 3. Blood glucose monitoring is only needed when the patient is feeling symptomatic. Absolutely not true. Blood glucose should be monitored routinely, not just when symptoms appear. Why? Because many times, patients don't feel the symptoms of hypoglycemia or hyperglycemia until it's too late. So, relying only on symptoms can be dangerous. Option 6. Blood glucose should be tested every hour to ensure levels remain stable. Nope, this is excessive and unnecessary. Testing before meals and at bedtime is the standard recommendation for most patients. Now, let's go over the correct answers. Option 1. Blood glucose levels should be tested before meals and at bedtime. Yes, this provides a clear picture of blood sugar trends throughout the day. Option 4. The test strip should be kept in a cool, dry place away from direct sunlight. Absolutely. Heat and moisture can damage the test strips, leading to inaccurate results. Proper storage is crucial. Option 5. The patient should wash their hands before testing to avoid contaminating the blood sample. Yes, dirty hands can lead to false readings. Always wash hands to ensure accuracy. Key takeaways for answering SATA questions. 1. Read the question carefully. Are they asking for correct procedures? Most effective interventions? True facts? Pay close attention. 2. Eliminate distractors. If an option sounds kind of right but doesn't fully match the question, eliminate it. Distractors often seem reasonable but don't fit the exact needs of the question. 3. Look for clarity in the answers. Avoid vague or overcomplicated options. Stick to what is clear, direct, and evidence-based. 4. Follow evidence-based practice. Choose answers backed by clinical guidelines and solid research. Never rely on assumptions. By staying focused, eliminating distractors, and picking the most relevant answers, you'll master select all that apply SATA questions with confidence. Look for patterns or groupings in SATA questions. Here's a pro tip. When answering SATA questions, look for logical groupings in the answer choices. If several options are related to the same condition or intervention, chances are they could all be correct. Similarly, select N questions often include related options that seem equally plausible. Spotting patterns can help you make the right choice. Question. A nurse is preparing to administer a beta blocker to a patient with hypertension. Select the 2 most important nursing considerations before administering the medication. Options. 1. Monitor the patient's blood pressure and pulse rate before administration. Administer the medication with food to prevent gastrointestinal upset. Assess the patient for a history of asthma or chronic obstructive pulmonary disease, COPD. 4. Check for a history of diabetes, as beta blockers may mask hypoglycemia symptoms. 5. Assess the patient's level of hydration before administration. 6. Teach the patient about potential weight gain as a side effect of beta blockers. Step-by-step analysis. What's the focus of this question? We are looking for the two most important nursing considerations before giving a beta blocker to a patient with hypertension. That means we need to think about patient safety and the key effects of beta blockers. Let's break it down. Analysis of each option. Option 1. Monitor the patient's blood pressure and pulse rate before administration. Yes, this is critical. Beta blockers lower heart rate and blood pressure, so if the patient already has low BP or a slow pulse, giving the medication could lead to bradycardia or hypotension. Always check these vitals first. Option 2. Administer the medication with food to prevent gastrointestinal upset. Not a priority. While some medications must be taken with food, beta blockers are not particularly known for causing GI upset. This is not a major concern before administration. Option 3. Assess the patient for a history of asthma or chronic obstructive pulmonary disease, COPD. Yes, beta blockers can cause bronchoconstriction by affecting beta-2 receptors in the lungs. This can be dangerous for patients with asthma or COPD. You must check for respiratory conditions before giving this medication. Option 4. Check for a history of diabetes as beta blockers may mask hypoglycemia symptoms. Absolutely, beta blockers can hide signs of low blood sugar, such as tachycardia. This means a diabetic patient might not recognize hypoglycemia until it becomes severe. Always assess for diabetes risk before administering. Option 5. Assess the patient's level of hydration before administration. While hydration is generally important, it doesn't directly impact beta blocker safety or effectiveness. This is not a priority consideration. Option 6. Teach the patient about potential weight gain as a side effect of beta blockers. While weight gain can be a side effect, it's not an immediate concern before giving the medication. More important considerations involve vital signs and respiratory risks. Correct answers. Monitor the patient's blood pressure and pulse rate before administration. Assess the patient for a history of asthma or chronic obstructive pulmonary disease, COPD. Check for a history of diabetes, as beta blockers may mask hypoglycemia symptoms. Key takeaways for answering Select N questions. 1. Identify the most critical nursing actions. Before giving beta blockers, think about safety risks, like low BP, slow pulse, respiratory conditions, and hidden hypoglycemia. 2. Eliminate distractors. If an option seems less relevant to the medication's immediate effects, it's likely a distractor. Example, hydration status and weight gain. They matter long-term, but aren't priority concerns before administration. 3. Look for logical groupings. Several answers may focus on vital signs, diabetes, or respiratory health. When you see patterns in the answer choices, they're likely important considerations. 4. Prioritize evidence-based practice. Always select answers that align with clinical guidelines and patient safety protocols.
By the way, the strategies we've been talking about in this video, those approaches for tackling tricky NCLEX questions and managing the different types of questions are actually taken straight from a resource I really recommend. The new NCLEX RN Practice Question Bank. If you're looking for a great way to practice and apply those strategies, this book has over 700 questions that mimic the real exam format, and each one comes with detailed explanations that help you understand exactly why the correct answer is right and why the others aren't. It's a great way to reinforce the strategies we've been covering here today. This book is especially useful if you're struggling with the new next generation NCLEX format or just need a structured way to build up your confidence with daily practice. You'll find it's all about practicing smart, not just hard, and really honing your test-taking skills. So, if these strategies are helping you out, this book could be a solid next step to boost your preparation even further. Just thought I'd share that in case it's something you want to check out. You've got this.